For years now, I have suffered from repetitive strain injury, or RSI, brought on by an extended use of computers without taking enough pauses and without listening to the signals that my body was trying to tell me. RSI is more of an umbrella term. My specific condition is Tenosynovitis, which is an inflammation of the sheaths around my tendons, specifically in both of my wrists. To try to combat this, I've been getting extracorporeal shockwave therapy from a Naprapath here in Sweden called Naprapath Clinic. And since I'm not an MD, I'm just going to read from the wiki about extracorporeal shockwave therapy. So, extracorporeal shockwave therapy is a non-invasive outpatient alternative to surgery for those with many joint and tendon disorders. ESWT sends acoustic shock waves into bone or soft tissue, in effect re-injuring the area on a cellular level and breaking up the scarring that has penetrated tendons and ligaments. The controlled re-injuring of tissue allows the body to regenerate blood vessels and bone cells, and the resulting revascularization leads to faster healing and often a return to pre-injury activity levels. So basically, precisely injuring specific areas and hoping that your body will make it better. So the first step of the treatment is actually an ultrasound. So here is the machine, and here you can see the result of the ultrasound, and that is to identify specific points where we need to apply the shock waves. You can, of course, do it on a more hand-to-hand feel, but having the ultrasound is something that I think is quite neat. I can actually see from session to session that the inflammation has gone down. And here you can see a little handle or head for the ultrasound, basically running it over my wrist. And here you have the resulting picture. So basically here you can see my wrist, you can see like darker spots where fluids are. The red spots here is blood flow activity, I believe. And basically from session to session you can actually see that the inflammation has gone down. So my perceived convalescence, or my perceived problems can actually be verified by these images that you can look like before and after. Here we have the shockwave therapy machine, which is basically a pneumatic, I would almost say drill, but it's a pneumatic shockwave gun or handle. So here you actually have it against my wrist, and it's actually vibrating to create these shock waves. And the session basically is, starting at one end and going over my wrist to the other side and then back again, stopping at specific trigger points or specific points where I have more problems. And here we have a little video. As you could see and hear, it is basically a small jackhammer that you run over these areas that creates these shock waves, and running it, this close, or as in this case, on the bone is quite painful. But for me, the result has been astonishing. I tried multiple years of just doing relaxation, physical therapy, nothing helped. After each one of these sessions, I feel much better. The pain goes away in a few seconds, and a few minutes after the treatment, I already feel better. And it's definitely something I would recommend people with RSI or similar conditions to try out, or at least get in contact with someone and ask for, a session. And that's basically it. Take care. Stop recording.